you are, what's your name, all that good stuff. What school you went to, all that good stuff.
My name's Tiara. I went to Valley.
Valley College.
Valley College.
When did you graduate?
May of last year.
Okay, all right.
I never took the test. I just felt like with Valley, I didn't learn a lot. If anybody in here went to Valley, you went to Valley.
There's a lot of Valleys in here.
I feel like the program is just too accelerated. I mean, we had sometimes 16 chapters in like 1 week.
No.
Yeah.
And this is for the non-reading public.
Yeah, and then we would have clinicals one day, so sometimes we would only have 2 days of lecture.
Oh,
then we would test and have clinicals, and I was just like, I don't think I should take this test.
Nothing.
Yeah. So I wasn't
and
confident.
how long was the program?
10 months.
10 months. So what can you learn in 10, right? Yeah. That's why I get a lot of the schools.
Yeah. And so, So I took my test April 15th. I did 85 questions, and then the computer shut off.
That's what I'm talking about. That's what I'm talking about.
I was like, is this a glitch or are we finished? Like, what's going on? And then when it said you have completed it, I was like, ooh, thank you, Jesus. Like, I'm out of here.
Let me get me out of here.
Yeah, let me get out of here.
And you live far, so you had to travel here.
Yeah, I stay in Aurora, so.
Yeah, Aurora Farms.
Yeah.
Aurora Farms.
Aurora.
Yeah. So, who remembers this precious baby being right in class having an asthma attack? Remember that? Yeah. So we have an inhaler here because we know it was like 3 of them all in a row that week. The seasons change, asthma just kicks our butts, right? So we know that it can be so bad, and it's like my ear has an ear for that cough. It's a certain kind of cough, isn't it? It's very congested, wet, kind of crazy cough. And I was like, oh no, don't leave, because I don't want to lose her, because it's like bad memories. Yeah, this is very real. So I was so proud of her for just staying with it, even if she wasn't in class, because she's been so sick. She wasn't in class, but then she didn't drop anything. She stayed the course. So some of you may have little challenges, but then when you're not in here during your challenges, try your best to stay the course, because when she could come, I could see by her scores, she's not stopping. She's doing it. And it's a big deal. You're sick of that. Yeah, she's in here a little while just because, like I said to her, and it was a little pressure on me. She didn't know it, but I put pressure on myself probably. But one of her family members asked me to love on her, take care of her. And that person that asked me that is one of the most important people in my life. So the pressure's on, because she failed. I look like an idiot to one of the most important people in my life. So I was like, oh God, every Sunday I'm called, what you doing?
She's like, when are you taking your test? And I'm like, on the 15th. She's like, study this, do this. And I knew you were putting pressure on yourself, but I'm like, don't put pressure on yourself. It's on me, it's not on you.
Girl, shit. That's some bullshit. That's some bullshit. It was pressure, okay? Because you have no idea what that person means.
But she thinks very highly of you.
Oh.
Yeah, she thinks really highly of you. So we talked about you, and she's like, she knows her stuff. I said, listen, I don't know how she know all that stuff, but her mind is just crazy. Like, I wish I can just take all that information and put it in my head, but I was just like, yeah, she really knows what she's doing. Yeah, so.
Well, I want her to get a job in the ER. So I don't know if you have one yet or if you need a little bit of time, but I want you to get started right away in this ER.
Yes.
When you're an LPN, we hire you in the ER, very happily so, because you guys do a lot. Like, you have a lot that you can offer. And finally, our hospital systems are finding out the incredible importance of the LPN role. What they did was unforgivable years ago. Remember what they did? They just fired everybody. Said, oh no, we're going to an all RN staff. That didn't work so well. So they are recognizing that we are a team, and it should have always been like this. So now it's like all these LPN positions are available here. So I think that she would be a good fit because she's so brilliant, and we don't want dump people in the ER. You don't need that because you got to work fast and you got to triage really, really well. Okay, RN or LPN, whichever one you are, you have to really be on your toes in that ER environment because it's so hard. What do you say to advise these babies?
If you do the program like it says in your packet, you'll be out of here much quicker.
Well, you had some challenges.
I had challenges, but also too, I think
I was
a little bit. Yeah, I wasn't doing the program.
Working too much.
That too.
Yeah,
like I was working too
lot.
much. I mean, I know we all have bills and stuff, so you can't necessarily stop working, you know. But I was doing more than the 20-hour minimum that she said, and sometimes I would come in and I only had like 5 questions. So if you could do more than 5 questions a day, like really try to do more than 5 questions a day.
Because you took off when you started doing that.
Yeah,
you
I
really
started
did.
doing more questions, and that kind of really helped. I did still do 5 at a time because I feel like it's easier to manage.
I definitely
But if you can just continue to do 5 questions all day, every day, like you said, boot camp also helps because it kind of helps you think like,
oh yeah, you were
when you're taking the test, like, okay, what is it asking me exactly? And then with Dr. Shelley, she doesn't take no for an answer, and I'm like, well, I don't have an answer to give you. Like, I don't know what you want me to
I don't know, crap.
what you want me to say. But yeah, boot camp helps if you can come to boot camp. I came a few times, so I think boot camp is good. And then just doing your UWorld questions.
Yeah.
So.
I'm so damn proud of you.
Thank
My God, no dummy here. She got this. Every time she would come, her scores would go up higher. I'm like, oh, okay, I see you.
Thank you.
So I'm just like enthralled. 85 and out.
Yes.
Gonna be an ER nurse.
Yes.
Just feels good.
Yes, thank you.
You had a lot of stress. How does it feel?
It feels relieved on one end, but then it's like, okay, now I'm really out there. I can't say, oh, let me just go ask my teacher. I have to actually know the answers.
Y'all still call me at work.
Yeah. So, yes, relieved. Thank you.
You're welcome,
Thank
baby.
you.
All right, you're good, baby. You're taking